We now have 2 vaccines on the market that help prevent against the 2 most common strains that cause cervical cancer and the 2 most common strains that cause genital warts as well. There are many benefits to the HPV vaccine. This is something that I talk about with my teens, adolescents, and young adults almost every day in the office. Remember that HPV is a virus, and the virus can cause many different types of medical conditions, but some of the more common are cervical cancer and genital warts. Again, there are other types of cancers that can be caused by this virus as well, however. Now, there are many different strains of this virus, but we now have 2 vaccines on the market that help prevent against the 2 most common strains that cause cervical cancer and the 2 most common strains that cause genital warts as well. So in essence, by getting the quadrivalent vaccine, that's a vaccine that covers 4 different strains of the HPV virus, you can actually get coverage from the types of HPV that most commonly cause cervical cancer and also the 2 types of the HPV virus that cause genital warts. This is in essence a vaccine against cancer and an STD, which I think is actually very important. It's also important to remember that most children, adolescents, and young adults can receive this vaccine starting at 9 years old, going up to about 26 years old. People often ask me about the side effects, and I can tell you that one of the most common side effects is what we call local reactions, meaning at the site of injection, perhaps in your arm, you might get some redness or some swelling and maybe some pain. Typically it is self-limited, meaning it lasts for a short period of time. Of course, if you have any complications, you really should speak with your doctor. But is this vaccine a great way to protect young people against cervical cancer and possibly genital warts as well? Absolutely, and you should speak with your doctor about this.